Assalamu alaikum. My name is Asul Abdurazak Ahmed. I'm a medical lab officer stationed at Shuda Sub-County Hospital. I'm also the TB lab person. I'm the deputy quality officer at the facility. Today I'm going to talk about quality in relation to TB treatment. Main issue is to enhance sputum diagnosis through the GeneXpert. Okay, we picked this project from December 2022, that quarter of July to December 2022, and we realized that our utilization of sputum uptake was 22%. That was due to several aspects that I'm going to talk about. Okay, some of those aspects were we had fewer trained personnel who were not able to perform the sputum diagnosis using the GeneXpert. Also, we had inadequate commodity supply from KEMSA. We get our supplies from KEMSA. Then we also had an interruption of internet, and at times we didn't have internet. So that was one of the reasons that was making us not going to go online as far as sputum sending through online is concerned. Then we had power interruption. We could be performing the test and then there will be power cut-off that leads to incomplete test, or the test sometimes abort. So that is a problem. Also, we have a sample from other facility that do not perform GeneXpert at their site. So actually what happened is samples are being referred to those sites, and at times it's really a problem because we rather have a sample than having the patients. So sample have to be sent by a rider. So that was also a major drawback as far as utilization is concerned. So how did we tackle this? Okay, we have monthly meetings to talk about how we can have our machine to fully utilize and scale up the uptake as far as GeneXpert is concerned. Also to help patients from different facilities to access our services. That we had to do through meetings, laboratory meetings with the staff that are there, and also at the same time we have to do meeting with the TB clinic because there was some issue also in the TB clinic as far as the sample is concerned, sample size is concerned, sample quality, and the filled up laboratory form, which was not fully and correctly filled. Okay, how did we do this? We actually sat with the administration of Shuda Sub-County and the partners who were able to assist us. In that way, we were able to have internet supply that was interrupted. The facility was the one who was operating it, who was assisted us in that. And UPS was also purchased by the facility that also helped us in case there was a power cutout. That used to have kind of a backup, it was a backup. So as far as samples faring from sites that were non-GeneXpert performing, or they didn't have GeneXpert, we had a supported rider from USID Stawisha Pwani. So the rider used to collect a specimen from those sites and ferry them to Shuda Sub-County Laboratory. And then as far as the forms are concerned, we had to OJT, that is we had to train the clinician at our facility that is from different departments. Our facility is an integrated department. So from every entry that sends sputum to our lab, we train them on how to fill the form duly, because without the form being filled, it was very difficult for us to send SMSs and also to send email. So when when we trained them, they were very cooperative. We also had the issue with the quality and size of the sample. So we had to train the CHVs. Of course, that was supported by partners, and it was a fruitful exercise. So the results, all the challenges were addressed according accordingly from the county, because we also had support from the county. The county used to come and supervise our work, and at the same time we have a forum whereby we talked about the sample size and how to fill. So it was kind of something that could be addressed all through the county. Then the facility, as I said, we had health talks and CMEs that were in relation to the specimen and the forms. So the TB clinic, we had, as I said before, I'm a TB lab focal person. So whenever we have a meeting, I put in that what they're supposed to do and what can be done, and together we facilitate that as a team. So the CHVs, like I said, okay, on the ground we show them the kind of sample we want, the quality of the sample, because GeneXpert has a certain amount that needs to be processed. Like in this case, we have a ratio of the buffer and the sample 2 in 1. So if it is more than that, it can actually have errors, and that it can be a loss of cartridge and manpower, of course. So patients were able to be diagnosed early. As I said, okay, maybe I forgot to say, GeneXpert is a PCR, and it's a real time whereby you get the results within 2 hours after processing. The 2% which we had, as I said, it had no SMSs, it had no email, because of those major drawback as far as the forms are concerned. They were not fully filled, I think I mentioned earlier. And then there is TB utilization, that is the one that is showing that you're online and the results are being communicated to the national and the county. That was also not there because of the GeneXpert not having internet. Okay, the table will show us in July to December 2022, we had 22% of the GeneXpert utilization. That is a low as far as Chuda is concerned, because we have a catchment area of between 100,000 to 120 people. So after the intervention and challenge that were addressed, an increase was noted, and this is shown in the table 2 of between January to June 2023, with an increase from 22 previously, from the previous quarter, to 59% after. So we intend to work through the remaining challenges by using the partner, Sister Wisha, who sponsored the rider to collect the specimen from non-GeneXpert site. I said earlier that, sorry for repetition. And the filled up forms, we still encourage the clinician to correctly fill the form for sputum, that is sputum lab request form. So far, even the CHVs are happy because they're able to access their results online. So before the hard copy reaches them, they already have the results for their patient. So they can actually go to the patient or even call them so that they can come to the facility and have their treatment early. This in result has encouraged early detection of TB, that is if any, and early treatment for those patients who are infected. What I will say is this is encouraging because teamwork and positive attitude that has been shown with all the stakeholders at Chuda Sub-County Hospital has yielded fruitful outcome. And we intend in future to sustain, that is ongoing, we are sustaining all the measures taken so far. Thank you very much.